Arnold, our muscle man, and we are going to start at his most distal end on his foot. So I'm going to introduce the tibialis anterior. It attaches here on the anterolateral side of the tibia, and it inserts on the medial cuneiform and the first phalange. It is a dorsiflexor of the foot, and it also extends the ankle. The extensor digitorum longus is next, and it attaches on the shaft of the fibula. It comes down and inserts on the distal phalanges of the foot. Again, it is a extensor of the foot and a dorsiflexor. Underneath that, we have extensor hallucis longus. It also attaches on the midshaft of the fibula and comes down and attaches to the distal end of the first phalange. And if we turn him a little bit sideways, we have the fibularis longus. It attaches on the lateral shaft of the fibula, comes down underneath the foot and attaches to the medial cuneiform on the dorsal end. And then we have the fibularis brevis, attaches on the lateral midshaft of the fibula, again comes down and attaches to the first cuneiform of the first. And they both plantar flex the foot, fibularis longus and fibularis brevis. Now we're on the posterior leg. We're going to start with the most superficial, if Arnold doesn't fall over first, which is the gastrocnemius. It attaches on the condyles of the femur, the posterior side, and it attaches, or it inserts, on the calcaneus. It is a plantar flexor of the foot and a flexor of the knee because it crosses two joints. Underneath that, we have the soleus. It attaches in between the tibia and the fibula, or it originates, inserts again on the calcaneus. It is a stabilizer of the leg, and it is also a plantar flexor. Underneath that, we have our flexor hallucis longus. It attaches on the midshaft of the fibula, comes down, goes around the lateral malleolus, and inserts at the distal phalange of the hallucis. It is a flexor or a plantar flexor of the foot, and it also flexes the big toe. And underneath that, we have our flexor digitorum longus. It attaches on the posterior shaft of the tibia, comes down again over the lateral, or around the lateral malleolus, and inserts on the distal phalanges of 2 through 5. It plantar flexes as well as flexes the toes. His toes are rigid, so we can't show that. And deepest to everything is going to be our tibialis posterior, and it attaches on the tibia and comes down and inserts on the cuneiform bones, the cuboid, and also the metatarsals down here. It again is a flexor, plantar flexor of the foot. So we're going to start with the rectus femoris on the leg. It attaches to the posterior inferior, or anterior inferior iliac spine is the origin, and it inserts at the patella. It is a hip flexor and a knee extensor. And then below that, we have our vastices. So we have our vastus lateralis. It attaches on the greater trochanter of the femur, is the origin site, and then it inserts at the patella. Again, it flexes at the hip joint, extends at the knee joint. The vastus intermedius attaches on the anterior side of the femur. It comes all the way down, and all three of these attach at the quad tendon at the patella. It again is a flexor of the hip, extensor of the knee. And on the most medial side of our quadriceps muscles, we have our vastus medialis. Attaches on the medial shaft of the femur, comes all the way down into that quad tendon, and attaches at the patella. And moving on to Arnold's other side, we have the sartorius that attaches at the anterior superior iliac, or originates at the anterior superior iliac spine, and then inserts on the medial shaft of the tibia. And it is a knee flexor and also an abductor. And the gracilis attaches at the pubic ramus here, or it originates at the pubic ramus and attaches again on the midshaft of the tibia, and it is a adductor of the knee. Talking about the posterior leg, we're going to start with the most medial, which is the semimembranosus. It attaches on the ischium right here, or it originates, I should say, and then it inserts on the medial side of the tibia, and it is a knee flexor and a hip extensor. Then we have our semitendinosus, also attaches on the border of the ischium, or originates on the border of the ischium, and inserts on the medial side of the tibia shaft, about a quarter of the way down, and it is a hip extensor and a knee flexor. Then underneath that, we have our biceps femoris, long head and short head. So long head attaches on, or originates on the ischium and inserts on the lateral side of the fibula. The short head originates on the midshaft of the femur, on the linea aspera, and it inserts on the lateral side of the fibula. Biceps femoris is also a hip extensor and a knee flexor. And then we're going to move over to our adductors. Don't mind the fact that he has no hip socket anymore. We'll start with the adductor magnus. It originates on the ischium, attaches on the distal side of the linea aspera. Adductor adducts the leg, so we add back together. Then we have the adductor longus. It originates on the pubic ramus and inserts on the proximal linea aspera. Again, we adduct the leg, and most deep is the adductor brevis. It originates at the pubic ramus and inserts on the linea aspera of the leg. Also adducts the leg. There you have it.
So now we're going to talk about the pelvic girdle, starting with the most superficial muscles, moving to the deepest. Most superficial, we're going to have gluteus maximus. It's that really large muscle in your butt. It inserts all the way across the iliac crest originates across the iliac crest all the way onto the sacrum and the coccyx. So this would actually extend a little bit more this way, and then it inserts all the way down on the gluteal tuberosity of the femur. Gluteus maximus is responsible for lateral rotation, which Arnold here doesn't do very well, abduction, and extension of the upper leg. Moving down, gluteus medius, another large muscle, not quite as large as glute max, originates on the iliac crest of the sacrum and attaches onto the greater tuberosity of the femur. Gluteus medius is responsible for abduction. Moving deeper still, gluteus minimus attaches on the iliac crest a little bit more inferiorly, so kind of the body of the ilium, and also attaches on the greater trochanter, again responsible for adduction of the thigh. We have piriformis, which attaches on the anterior side of the sacrum and then inserts on the greater trochanter. Piriformis is responsible for lateral rotation and stabilization deep in the pelvic girdle. We have the tensor fascia lata, we're moving a little bit more anteriorly, which attaches on the anterior superior iliac spine. Tensor fascia lata then becomes a very tendinous piece, which is your IT band. IT band goes all the way down the femur to the tibia. It's very important in knee stabilization. So tensor fascia lata, important for flexion, medial rotation, and abduction of the leg. Spinning Arnold around. Going to move his rectus abdominis out of the way. We have psoas major and iliacus. Psoas major attaches at the bottom of the thoracic spine and extends into the lumbar spine, so T12 through L5, and inserts all the way down in the lesser trochanter of the femur. So psoas major, responsible for flexion of the thigh and deep for stabilization. Iliacus originates on the iliac fossa and inserts as well on the lesser trochanter, the femur. Again, flexion of the thigh, deep stabilizer muscle.